A cancer diagnosis can certainly be devastating, and then trying to figure out a treatment plan, it can get confusing and terrifying, especially when you don't know all of your options. Dr. John Kressel of Phoenix Cyberknife, he is here to tell us more about their unique treatment, really giving patients a lot of new hope. Good to see you.
Thanks, Susan.
You guys, I mean, obviously you're using revolutionary types of equipment and state-of-the-art equipment to help treat this type of cancer, which it's many, but you guys are also being looked at really as kind of the mark for other facilities around the country. How so?
Well, I and my group decided to bring a state-of-the-art radiosurgery center to Phoenix. So Cyberknife and another device called TrueBeam SDX are side by side each other at our center, and that's the first of its kind in the country, and actually was the first of its kind in the world.
How do these machines work, and what makes them different than what's currently being offered to cancer patients?
So traditional radiation therapy is being improved and revised all the time. So radiosurgery is currently the state-of-the-art, much more accurate, much more precise, treating the target, sparing more normal tissue. So, 9 weeks of traditional radiation therapy now can be delivered in 5 days or less because of that precision.
And are there side effects just like what would come with, regular surgery or radiation?
There's always side effects with any treatment, but many times we can limit those or reduce those much more because of the precision. Sparing more normal tissue, healthy tissue, reduces the risk of those side effects in many instances.
And let's be honest, not a lot of people know about this treatment option. Why is that?
Well, it is relatively new, so that's one of our biggest missions, is educating physicians, educating patients. You really should go check all of your options before you make a decision, and unfortunately not everybody's been trained in it. We have a collection of physicians who are specialized in Cyberknife radiosurgery, but not everybody is. So if they don't know about it, they may not offer it to a patient.
It's a word of mouth right now, and I know you're really leading the charge in trying to make this a more common household thing that people consider when they are faced with this terrifying experience and ordeal. And for a lot of those patients, paying for their treatment is another scary obstacle that they have to overcome. Will insurance cover this?
Yes. It's an evolution. More and more people are learning about it, but there's a lot of good data on its outcomes. It's safe, it's effective. Medicare covers it. All of the insurance companies cover it for the appropriate patient. So it's becoming mainstream, but since it is something that requires additional expertise and equipment, it hasn't been something that's available everywhere, but it is available in Phoenix.
And I can imagine, Dr. Kressel, when people come to you, they have so much on their minds. Worrying about how to pay for something is probably the last thing they need to be worrying about. What type of cancers will Cyberknife treat?
Pretty much from head to toe, but the ones that are most common are lung and prostate, head and neck, spine, brain, breast, so a variety of them. I think the ones that we're getting the most interest in and the most rapid most rapid acceptance in for radiation oncology is for lung and prostate.
Yeah, and you're going to be joining us a little bit later in this program to talk about a really revolutionary study and test that was done that you're leading, so I appreciate that. I want to go back to the types of cancers that you were talking about. Do we have to be at a certain stage? Like if we're at stage 4, can we still come to you, or stage 1? I mean, where do we fall in that? Where is this most effective?
Great question. So early stage patients are appropriate, and even advanced stage patients. If there's metastatic disease, many times Cyberknife can be very effective in treating patients who've had disease that's spread to other parts of the body. So it's not just for a very small group of patients, it's for a very broad category.
What's the success rate?
Well, again, it depends on what type of patient and what type of disease we're treating. But in some instances, like this lung study that we'll talk about later today, it actually was as good or better than surgery with regards to survival and side effects.
That's got to be promising.
Yes.
That's got to be promising. Well, you're going to hear more from Dr. Kressel coming up in just a little bit, and you're going to hear from one of his patients as well. If you have questions for Phoenix Cyberknife Radiation Oncology Center, you can email them, info@pcroc.com. We're going to give you their address coming up in the next time we speak with him, but you can call 602-497-0605, and you can visit them online as well. Thank you. We'll see you in just a little bit.